Greetings everyone, I'm Shujat Ali from Medicals Lectures by Shujat, and today we are going to talk about obesity. So it's an increased fat accumulation in body associated with vast comorbidities. Life expectancy reduced up to 10 years and chances of heart disease are far more greater as compared to person with normal weight. So let me quickly tell you the summary of this lecture. What we are going to discuss is first methods of measurement, how we can identify a person is obese, underweight, normal, overweight, as well as complications, risk factors, and treatment, surgical, pharmacological, behavioral, and at the end we are going to make a conclusion. So let's discuss our first point, which basically is methods to identify a person is obese, overweight, underweight, or is normal. So first method is body mass index, measured in kilogram per meter square, having different values from which we infer a person is obese or normal weight. So if body mass index is less than 18.5 kilogram per meter square, person is underweight. If body mass index is in between 19 to 24.9, person is having normal BMI, weight is normal. So if body mass index is between 25 to 29.9, person is overweight. So if BMI is greater than 30, person is obese and is of class 1 obesity. Class 2 obesity is greater than 35 kilogram per meter square. Class 3 obesity, which is basically dangerous, so it's greater than 40 kilogram per meter square, person's body mass index. So second is waist circumference, measured from iliac crest point. So if person's waist circumference is greater than 1 or 2 centimeter or 40 inches, so that person is obese. And in case of women, if weight is greater than 85 centimeter or 35 inches, woman is obese. So when you talk about different complications, so it's a group of complications that will ultimately mount up and form obesity. So might be there is some hypothalamic problem. So due to that hypothalamic disturbance, sleep-wake cycle disturb, and basically lifestyle changes. Might be genetic problem. There might be hypogonadism, which is basically relevant to cortisol levels. Might be due to poor diet, due to poor behavior, due to poor eating more junk, and also associated with Cushing syndrome, buffalo face, moon face, buffalo hump, polycystic ovarian syndrome in case of women, associated with hirsutism, growth hormone reduction, and different drugs, antipsychotics, beta blockers, antidiuretics, antidiabetics, and antidepressants that basically mount up and ultimately lead towards obesity. So we have different complications. Every organ almost, if person is obese, affected due to that obesity. GERD, gastroesophageal reflux, heart diseases, hypertension is most common, fatty liver diseases, diabetes, urinary incontinence, hernia, venous thrombosis, gout, and metabolic syndrome, which basically complication of diabetes, obesity, and hypertension which develop. So obesity is one of the most important cause of metabolic syndrome as well. So when we discuss about how obesity is developed in person, how we can treat, so there is different non-pharmacological interventions. First is modify lifestyle, indulge exercise in that person's lifestyle, as well as a very healthy diet, avoid junk, avoid eating after 9, and realistic goals must be set by person that I have to reduce my weight, or let's say 10 kg, 5 kg, depending upon how much overweight that person is. Second one is with the help of pharmacological interventions with drugs we can reduce weight as well. So first drug is GLP-1 agonist. What it do? It reduces glucagon secretion, as well as it slows down the gastric empty. So person doesn't feel hunger, so start ultimately reducing weight. Second drug is orlistat. It acts on pancreatic lipase, and lipase act on hydrolysis mechanism of fat. So at the end result, ultimately fatty acids, they are not absorbed, so due to that we have chances of reduction of obesity. Third is sympathomimetic drug phytoramine. So it's fight or flight, so it acts to reduce weight as well. And last but not the least is bariatric surgery. In bariatric surgery we use either adjustable gastric bands to reduce the volume as well as to reduce circumference of stomach, to basically reduce down the hunger. And secondly we use sleeve gastrectomy, in which part of stomach is removed like this. And remember one thing, surgical interventions, they're basically preferred in last stage, where pharmacological, non-pharmacological treatments, they all failed, so we have to do surgical interventions to basically shift our person from red to green zone. In the end, I just say in conclusion, we have to give our body its time. We have to indulge ourselves in exercise, in healthy diet, in healthy routine, to avoid these severe conditions which are developed due to obesity, because it's in our control. So that's why let's make a promise that we will do our best to give our body time. So in the end, I just request you, if you are new to Medico's Lectures by Shujat, don't forget to subscribe Medico's Lectures by Shujat. In case of any query, you are more than welcome. My contact number is mentioned in channel as well as Facebook page description. Stay tuned, stay healthy. Thanks so much guys. Thank you.